Our focus is on mission. Hey there, welcome back to another podcast. You're here with me, Tony Stan, your host. If this is your first time tuning in, I invite you to go follow our Facebook page, Instagram, to learn more about the upcoming episodes that we have. But today, I'm happy to be here with Ma'am Ann Amparo. Thank you so much for being here.
Thank you for inviting me, Tony.
Well, it's the first time, so I hope there's more to come.
Yeah, sure.
You and I pass each other in the hallway. We've had dinner once in a while in bigger gatherings, so we don't know much about each other. I'm pretty sure the people around our division, they may hear your name, they may see your photo, but they may not know much about you. Could you share a little bit about your background before coming here and working for our institution?
Okay. Where will I start? Well, I grew up in Mindanao, in southern Philippines, in General Santos City. I was born there, and I grew up there. I went to study in our church school for grade school, elementary. But the rest of my education is in state universities. So I'm a public school kid, if you can say that. But I grew up in southern Mindanao Mission, in that area, and I have 4 siblings, and I'm the eldest in the family. So my parents are actually native of the Panay Island. So my father is from Iloilo, and my mom is from Rojas City. So, and then they migrated and ended up in General Santos City.
I see.
And then I went to university in Manila and stayed in Manila for about 16 years. Took up business administration and accountancy, and then had my master's and went to work for the corporate world, So, but eventually I was, this is a story.
Go ahead.
I really wanted to be a doctor.
Okay.
When I was young, and even when I was in college, but I'm like the eldest among the 5 children in the family, and I was thinking that if I would take up medicine, the rest of my siblings would be in college, and it would be very challenging for my parents. So I decided to take up accountancy because I was really good at it during high school, and so I graduated with that degree. And still, I had this kind of unfulfillment, because I really wanted to be a doctor. And when I go to hospitals and I would see, people wearing white, and I would somehow have this struggle inside me. But then, I had to be practical and just went on and just dreamed of making it in the corporate world, in the finance sector. And when I took up my master's, after my master's, I was unemployed for about 2 years for 3 reasons. One is I was overeducated because I had my master's when I go apply, And second, there would be the Sabbath issue. I was thinking that with my master's, I would be able to, really pursue a career in a financial institution. But then the issue there, usually if you go apply with banks, is that they have, overtime Friday
and Saturday,
Sabbath. So that was another reason. I would usually be shortlisted, and I have already memorized the exams, interview questions in all these banks. But after being shortlisted, then I will have to ask about Sabbath schedule and all that.
Yeah.
So. And then the third reason was that I was under experience because I came from a small company. And so those 3 things, I was unemployed for about 2 years. And I said, Lord, just give me a job. Let me have a job that's challenging, that would use my skills and my experience. And as long as there is no Sabbath problem, then I'm good with that. And so the first call for interview, I got accepted The owner was a fellow alumni from the university, and so he he made adjustments for me, so I didn't have to go to work on Sabbath.
Nice.
And so, but then staying in the company for a few months, I realized it was bankrupt. So it was really like, a very challenging job that God answered my prayer. But even during that stay there, I was already wondering, Lord, why does it seem like I've never really been fulfilled ever since I graduated? I was always restless, never really happy with what I'm doing. But and I said, maybe I don't belong where I am. Maybe I feel like a square peg in a round hole, and like then reflecting on what I really wanted to do, that I wanted to be in the healing ministry. I wanted to be a doctor. And then during that time, this was in 2003,
Okay.
when there was a change in our country's administration. And it was a time when a lot of professionals were leaving the country. And at the same time, there was a boom in the nursing sector. Like, people were boom in a sense that the U.S. opened for employment for nurses. And so, like, even doctors were taking up a second course just to leave.
I remember those days.
And so I was like, oh, maybe I should go into nursing because it's nearer to what I wanted to do, to be a doctor. So nursing is nearer. So I was already thinking about, taking up nursing. And there was a friend of mine who was like saying like, yes, Joanne, join me, because her background is in accounting and she's like already taking up nursing. So, okay. And then I prayed about it. And at that time I said, Lord, never really felt fulfilled, so maybe I need to give you the driver's seat. And I've been pursuing my own aspirations, and now I'll give you the driver's seat. And like, I was thinking it was going to be nursing. I was reading at that time The Purpose-Driven Life, the book by Rick Warren. And there was also the Sabbath school quarterly lesson at that time was about, I think it was about if you have been saved and you're born again, how you live your life as a saved person. And so the thought was going into nursing. And then with this prayer and with this mindset at that time, a friend of mine whom I haven't, talked to in a long while, suddenly emailed me out of the blue. And he said that he just found my email in, at that time, we share emails, like you forward emails, and you see all these email addresses. And so he saw my email address, and that's when he contacted me and asked, where are you? What are you doing? And all that. So I said, like, we're here. I'm still in the Philippines. And he said, would you like to work for the church and then work for one of our hospitals in Central Philippines, Calbayog, Sanitarium and hospital at that time. And I was like, my reply to him was, I don't want to have anything to do with accounting because with business, because I felt like I don't, I have this struggle with what I'm doing. But he said that, he would like to talk to me and just talk about the need there. And I said, but yeah, you can. And so he called me and we talked for more than an hour or so. He was just explaining how things were in the hospital in Calbayog. And it so happened that he's a doctor who was taking up nursing and was doing his internship already in Manila, in our hospital in Manila. But he was called to serve in Calbayog because Calbayog at that time was about to be closed. And but then our division officers and union officers decided to keep it open because that was the impression and conviction that they had when they visited the hospital. when they were about to announce that they will close the hospital. But then they decided to keep it open, and their condition was get a doctor as president and medical director and a good finance person. And so he was inviting me to go there. And at that time, I was saying, Lord, this is not what I wanted to do. Like, I wanted to take this is not the plan. And so at that time, I was like negotiating with my mom to help finance my nursing studies. But she didn't really seem enthusiastic about it. And so I took that as a sign that, it's like a closed door. And so the book, Purpose Driven Life, was saying, Rick Warren was saying that if God's will is in it, it will flow. But if God's will is not in it, it is forced. So I was like thinking, it's like I'm forcing this issue. And so that was at the back of my mind as I was, this offer came. And at the same time, the study during that week was saying that if you are really surrendered and if the Lord is asking you to sacrifice, you will have to give up something that is valuable to you. And so I was like, okay, Lord, so maybe you really, since the door seemed closed, this, the nursing, the direction to take up nursing is not like panning out, then I think you're pointing me to Calbayog. And so that was really unusual for me because I was really set on like pursuing a career in finance and business. I didn't want to even go back to General Santos City to work there because I thought, professional development is in Manila. But with this direction, it's like totally out of, it's not like me. And what was very, part of the strange thing was that Calbayog is like 20 years behind Jensen.
Okay.
So I haven't visited the place, but I was already convicted to go because I said like I'm surrendering the driver's seat to the Lord, and this is where He wants to take me, and so I will go. Right? So that was the conviction. Then I was telling my friends, that I'm going to Calbayog. And they were saying, where is that? Where is Calbayog? And then I even had a friend who was she's a doctor and she has been a missionary to one, I forgot which country in Africa. And so she was like my ate. My big sister. As I was telling her that I felt convicted to go to Calbayog. And she said, which was, I found the reaction also strange because I was thinking that she would encourage me, having been a missionary herself. And it's like, have you been there? It's like, you need to visit the place before you make the decision. But okay. So I visited the place, but deep in my heart, I was already convicted. It wasn't like I will just go through the motions, but I already made my decision because I surrendered that decision to the Lord. And when I visited the place, it was better than what I expected.
Okay.
Yeah. So that's the reason why I ended up in Calbayog, and that was the best decision I ever made at that time.
Yeah.
Because I never felt so much at peace knowing that I am pursuing God's will. I mean, I don't know what the future holds in terms of my career. Like they said Calbayog is like a Patmos Island. So it's like isolated because flights from Manila go there like 3 times a week, but they're very expensive. If you want to go to Cebu, you take the boat overnight. And also you can go via Ormoc, but it's very rough land trip. So it's like if you're pregnant from Calbayog, you'll end up giving birth
along the way.
so it's that tough, and but I felt so much at peace, and there was a lot, so much joy in my heart that I'm doing this for the Lord. If He gave His life for me, what can I not give him?
That's
So
true. That's true.
that's how where it
yeah,
started.
I mean, I love hearing your story, Mom, and I love how you saw and experienced as well God's leading. You said, I guess in my life, I kind of call those situations like God has cornered me, so I have no other choice of what to do. Like, okay, I did everything I wanted to do. God has now opened His door, and because you are in that relationship with Christ, it's like, okay, this is now that chance. That's seeing that story. Now I can kind of understand why you're here today.
Yes.
So could you share with us, like, what's the function that you do now for the Southern Asia Pacific region for the Adventist Church?
So now I'm the director of Adventist HealthCare, and it's serving the hospitals in the territory, and we have about 20 facilities across the division, but actually it's just the hospitals are in 4 countries now. Used to be 6, but we gave up the Bangla.
Really, only 4 countries. I mean, I know we have more countries here in our region. So that's Philippines, Malaysia, Indonesia, Thailand.
Yes.
Really? Okay.
Yeah. And most of our hospitals are in the Philippines. Like,
yeah, of course.
12.
It's a lot.
Used to be 10, but there were 2 smaller facilities that were added. So
what are some of these? I mean, I kind of heard from you the reason why you were called to Calbayog, but what are some of these challenges that you in organizing and maintaining and making sure that our services for mission exist in these countries?
Well, if you look at the job description, if you look at the manual of the division in terms of the department, it can be very overwhelming, the responsibilities and the coverage because, well, it has not been really reviewed for a long time, but it covers administration, finance, mission, and you have the medical side of it. And so they say hospitals are the most complicated organization to run.
Yeah.
And even the most stressful. There was, I think, a survey in the U.S. about the most stressful
like work
positions.
Positions.
It's like to be a CEO of a hospital.
Wow.
Because of all the challenges. You have a lot of regulatory things that you need to comply with. And then you have to deal with competition. And then you have to deal with professionals of various kind. You have all these medical professionals, licensed personnel that you have to engage with in the hospital, and then you have to take care of lives.
Of course.
So very complicated. And then you have also you're in an environment where technology is fast-paced. Like it changes.
Correct.
The equipment that you buy now can be obsolete in the next 3 years, and they're not cheap, like very expensive in millions.
And you're still paying for it.
Yes.
Yeah.
So the challenge there is how to make this institution sustainable, but at the same time mission focused.
Yeah. Speaking of mission, how do you see the mission of the church existing around these type of healthcare systems? What is that mission?
We say that the medical ministry is the right arm, right? So our hospitals are actually the institutions, what I would view as institutional right arms. And I think there was even a quotation from Ellen White that says that everything in the last days would cease in terms of the work of the church, but what would remain will be the medical work. So it plays a very important role in the mission of the church because it is the institutional right arm. And I believe that we have a lot of opportunities in our healthcare work. When I came into the position in the division, like my first, I was reflecting on why do we really have hospitals? Why do we operate hospitals? They're very complicated. They take up a lot of resources. They're very stressful to run because you have to deal with not only the industry but also different kinds of people and we see our hospitals struggling every now and then when it comes to finances. And I was like, so what difference are we making in terms of the mission if we're just another Christian hospital?
Correct.
Because if you look at other Christian hospitals, they also pray for their patients. They also want to be compassionate to their patients. They even have better resources. They even have better charity programs than we do. And so what difference are we making?
Yeah.
You know, if we're just another Christian hospital, why do we need to operate this?
Correct.
Why don't we just support our other ministries in the church? And in the process, you know, we've been talking about being mission focused, about being having mission enculturation in the hospitals. We talked about mission engagement, and it's still like I was wondering, what difference are we making, especially now at this time when, with the advent and the popularity of lifestyle medicine, what used to be a unique feature of our hospitals,
of our church,
Adventist hospitals,
Adventist
because
hospitals,
we go into health education, we want people to change their lifestyles. But with lifestyle medicine, everybody is going to lifestyle medicine. Even non-Adventists are very, passionate about lifestyle medicine. So now, what's the difference? And then COVID came. During COVID, we meet online and people would talk about things, and we ended up like wondering if we can use the New Start acronym for our lifestyle programs in our hospitals, because New Start is easily remembered, and it's popular in the Adventist community. But New Start is like copyrighted by Weimar.
Yeah.
And so we talked with Weimar now, like, can they allow us to use New Start? And in the process, while we were talking to them, the then Vice President for Operations of Weimar mentioned how they have been more mission focused in terms of ministering and reaching out to the patients who would go to Weimar. And they said they don't want to just make healthier sinners. So they need to be more intentional about mission. And they coined the tagline, "The goal is the soul."
Okay.
And when I heard that tagline, then everything just clicked, that yes, our hospitals are there to win souls, to touch souls.
Correct.
And we're not just there for, of course, Jesus went to heal people, right? Whether they would follow him or not.
Yeah.
But
True.
we need to be more intentional about winning souls. And in the hospitals, in my experience, when I was in the hospitals, we thought of mission like, we pray for patients, we give them health lectures, and this. And it's like,
That's it.
that's it. Like, we don't really need to be more aggressive about, eventually hoping that they would also follow Jesus. But with this, I became enlightened, and realized that truly the goal is the soul. And that makes our work in the hospitals more meaningful and more inspiring. It gives more purpose. So Simon Sinek said that we need to understand. We need to first understand our purpose in order for us to really be effective and successful.
Yeah.
And while we did thought that we're there for the mission, it wasn't that clear. In my view, in my experience, it wasn't that clear. And I thought that if hospitals are they spend more time, they're more intentional. They have to be intentional about planning for the business of the hospital. Like every year, we go on strategic planning, look at our programs and strategies, and review whether they're effective or not. And we spend time, like probably 2-3 days doing that.
Wow.
But what about mission? Sometimes it's just relegated or to the chaplaincy.
Yeah.
You pray and
But
you
it's
plan.
not part of the system. It's not part of the business side of it.
Maybe it's like it's part of the planning, but very little attention
Yeah.
is given, and like it's the chaplains, the
They give it to
pastoral
somebody,
people's job to think about that.
Yeah.
And then, but if our purpose is mission, if our purpose is winning souls, why are we not giving more attention, more time, and more effort on this? So our agenda in the board, like, I don't know how many percentage is given to mission. So the drive now is really to be more intentional about soul winning in the hospital. And when I talk about this, and from coming out of the pandemic, I started emphasizing this. Every time I talk about this with a group of hospital leaders, you can just see their faces light up, and it's like, this is what we should be doing. And sometimes people would even be emotional about it, because you finally realize that this is why we are here.
Correct. I find that if I do something repetitively, I start asking myself, what am I doing? Why do I have to do this? And so having that mission as a focal goal, or as part of our focus, helps us realign our passions and becomes more meaningful. One thing that came to my mind as you were telling me about the strategies, the business side of it, when I get to travel and I have conversations with the people around me, often when I say that I'm Adventist, they identify to a hospital.
Yes.
You see, it's like, oh yeah, but you come to find out that they may not be Christian, or they are Christian, but not necessarily, they don't believe in our faith, for example. But I met this one lady at the airport. Our flight was delayed, and I come to find out that I think it's 4 or 5, maybe it's 4, but all of her children were born at our hospital in Manila. And she would say all the good things about say all the good things, but in my heart, I'm also, what else can I do to say to her? There's this, she understands that we keep the Sabbath. She understands we have a certain diet, but it's running through my head. What can I say more that would maybe give her the seeds to dig a little bit deeper into what she believes? There was another lady that I met. I think I was with our communication director. And we were scouting a venue for an event, and come to find out that lady was actually born in our hospital. You're Adventist. Yeah, I was born in an Adventist hospital. So I think could you share with us what are some of the programs or resources that your department provides for these hospitals and professionals that are working within our Adventist HealthCare?
Okay, so with the mindset now that we need to be intentional about mission in the hospital, our direction is to help hospitals be more intentional. And we came up with the program I Care for Souls. And this is not a new one, because like I came from our hospital in Bacolod before coming to SST, and we had this I Care program, which stands for I am compassionate, attentive, respectful, and enthusiastic. So this is like the program that we use to have a caring culture in the hospital. Because we don't have a lot of resources. We cannot have all the advanced equipment in the hospital, but we can give the best service, a best experience in the hospital. So this program was used to create that culture, and we saw how it transformed how the hospital did things, and even how administration did things. Not just in terms of serving patients, but within the hospital itself. And so there was some transformation, but at the same time, we also saw how the community appreciated what we were doing. So we wanted to be the most caring hospital in the area. And with now me being here and wanted to be more intentional about mission or soul winning in the hospital, because during the pandemic, don't you mind, I will tell another story.
Go ahead.
During the pandemic, we saw a lot of baptisms, right? Even during the pandemic. And so I was like, if churches can have so many baptisms, why can't we see that in the hospital? In the hospitals where we have so many opportunities, we don't need to invite people to go or to come. And just in the hospital in Bacolod, when I left, we had about 10,000 admissions. And this is just for inpatients. So those are 10,000 opportunities for us to reach other people. We don't need to invite them. But what are we doing with these opportunities? So now, if the leadership in the hospital will be more intentional about doing mission, then we will see more baptisms, like even baptisms coming from the hospital. And so we wanted them to be intentional about planning for soul winning. And in the process, I requested Dr. Gayares. He, at that time, and even now, he was called to serve in Sheer Memorial.
Okay.
But with the advent of technology and the use of Zoom and everything can be done, even if you're far away. So I was like requesting him, like, can we pilot a hospital and help them plan for evangelism intentionally in the hospital? Not go out to the community and do evangelistic meeting, but plan how to win souls in the hospital. And so he came up with a framework, and then he went on annual leave, I think, and then he went to Bacolod and talked to someone in the hospital, and then realized that it's good to attach, use I Care for Souls, because we realized that we care for people because we want to win them for Jesus. And so that's why we came about with the I Care for Souls and came up with some kind of cycle of evangelism within the hospital. And we realized that, different countries would have different challenges, because in the Philippines, we're a Christian country and it's easy to just share, right? But our other hospitals have their own struggles, and so we need to have their own challenges. We need to come up with unique ways of doing mission intentionally in our hospitals.
Wow.
So it's I Care for Souls. And so because of that, many of our programs in the last, even when I started here, was like to equip people with things that they can do in terms of mission in the hospital. So we've had training for faith community nursing. This is like we wanted to tweak the faith community nursing because faith community nursing is like having a nurse in the church that attends to the health needs of the church members and then the community. But in the Philippines, it's so, I think we can coordinate with the hospitals so that the hospitals would
provide the service.
The services for the church and then the community. So that's one training we had. And now this week we're having we've asked Dr. Katya again to help us with training for lifestyle coaching and addiction recovery. So that's happening. This back-to-back workshop and trainings are happening this week. And so basically, we want to come up with programs that empower and help our hospital workers to be able to do more mission work. And of course, we've been promoting and doing eye care trainings in the different hospitals.
So this eye care manual or program, it's being used within our healthcare system around SSD.
We've visited we've trained people already from different hospitals.
Because, I mean, like if you come from a branding perspective, it's like if I go to one restaurant, I sort of hope that when I go to the same restaurant somewhere else, I kind of have the same menu and same hospitality. That is something that can be unique for us.
The eye care program is actually more of like principles, and then administration, wherever they are. Hospitals have different challenges and environments, so they can come up with programs that help promote. To
that. Okay, great. Well, I know you're a busy person, so thank you so much for your time. It's been a blessing.
Oh, another one.
Keep on going.
Because on September 8 to 14, the General Conference Health Ministries is holding these 3 divisions and 1 union. Regional Health Conference on Regional Conference on Health and Lifestyle in Penang, in our hospital in Penang, who is actually celebrating its 100th year. 100
years.
So the theme revolves around the 21st century sanitarium. So now we're revisiting, the reason why we came up with hospitals, why we have sanitariums. So it's not just us like doing these reflections and realizing what our mission is all about, but now it's also going to be a topic or the theme of the meeting, which is like 1 week, in Penang. And we hope to leave the conference with better insights, more inspiration, and more empowerment on how to pursue our mission as hospitals.
I hope that meeting, I'm going to be there with you, but I know that you're going to have several training sessions happening at the same time, and we hope that we can support your department, of course, from the communications department.
So this is not just for our division. Yeah. This involves the Northern Asia Pacific division, Southern Asia division, and I think the China Union mission.
Gotcha. So, but all the regional churches here, regional institutions here in Asia, basically. Okay. Our hospitals have an important role in sharing the gospel, planting seeds of hope.
I want to share to you a story.
Please, I was gonna ask you that exactly. Is there a story that's come about? Go ahead.
So, okay, let me just be a little bit dramatic about this.
Sure.
There was a family in the 1960s who migrated to Manila and lived near the hospital, our hospital in Pasay. And the family was poor. The father was a barber. The mother was paralyzed. And they had 7 children. One of the children, the second child, was a girl. And she was very sickly. So the father was a barber. So he would have clients coming from the hospital. And they saw that this girl is, sick. And then recommended that he take her to the hospital because they have some kind of charity program. Make the long story short, she ended up having surgery in the hospital. But this girl was befriended. She was about 16 years old at that time. Was befriended by a student nurse in the hospital. And after she was discharged, she would invite her, student nurse would invite her to church, would share food with her, and even give her clothes. And in the process, she ended up studying the Voice of Prophecy lessons, and she was baptized. And then they moved to Southern Philippines, and she was the first Adventist in her family, and her father was baptized after, and then also 2 or 3 of her siblings. And that was my mom.
Wow.
That was my mom. So I wouldn't be here now if it were not for the ministry of the hospital.
You see?
For all you care, she could have, if the hospital did not give her medical treatment.
And also the attention the spiritual attention.
And especially
and the friendship. Yeah. Exactly. I think a lot can be given. We don't give that much emphasis to the ministry that our hospitals have, and I'm happy to hear that from what you're sharing and giving inputs on as you work. We need to help our hospitals become some type of beacon and some type of center of influence in these bigger cities or wherever they are, whether they're on an island somewhere. And so I'm really inspired to see that circle. Of our hospitals existing, helping people like your mother, and then coming all the way back, and here you are.
Same paying back.
You're paying back, or you're still part of the
forward.
mission. Yes, but you're still part of the mission, and I think that's the beauty of it.
You want another story?
Keep on going. Maybe I might add another story.
This one is like recent one.
Uh-huh.
There was a patient. I think the wife, her husband had a heart attack or a stroke, so she had to take him to the hospital. This was our hospital in Bacolod, and they were thinking of bringing him to the government hospital because they only had so much money.
The funds,
But she remembered, there's this stories going around the area that if you want your patient to live, you have to take them to the Adventist hospital during an emergency. So then she ended up in our hospital and stayed there. The patient stayed there for a number of days. While they were in the hospital, the chaplain was very passionate about mission. Really befriended them and shared biblical inspiration to them, and so they became close. And eventually, when they were discharged, they were interested in having more
Bible studies. Yeah.
And so the lady chaplain looked for someone who lives close to them, and then one of our engineering staff began visiting them because he was living in the area, and he's like an elder of the church, and ended up giving them Bible study, like the family and extended family and neighbors. And I think in May, about 20 plus were baptized.
Wow.
Just because of one patient.
Wow.
And I heard that this family is like allotting or even donating a portion of their property for the church to be built.
Wow.
So, you see, who would have thought that they would, just one patient would end up with 20 plus
but
souls.
That's because our health workers and even the people working in the hospital, they have a mission in them. The work doesn't stop because the operation stopped or the healthcare program has stopped. They kept on going. I think that is what makes us different, as you were pointing out earlier. That's what sets us apart from these other Christian hospitals and healthcare centers. Looking at our discussion earlier, you walk through this journey. God led you down this path, and it's inspiring to hear the stories that have come out of our healthcare system. Would you have any inspirational thoughts or some input that you like to share with those who are working within our healthcare system, or those who are maybe feeling they would like to work within the Adventist Church's healthcare system? Have any thoughts for them and some encouragement to be part of this mission work?
I would say that the Lord leads us, and when we find ourselves working in our hospital, in an Adventist hospital, the Lord has a purpose for you. And because wherever we go, He has a purpose for us. But I believe that you who are in the hospital, you who are serving patients, or maybe you are not in the front line, but the hospital is a place where people come because they need something. And just like how sick people during the time of Jesus came to him, and they were healed of their physical ailment, but they still have a spiritual side that needs to be attended to. And that's a very unique opportunity for us in the hospital. So whether you are working in the front line as a nurse or as a medical personnel, or you may be in the support services where you're not really encountering patients every day, but every work that you do in the hospital contributes to that ministry of people getting not only medical care, but getting their spiritual needs met as well. And let me just share to you a quotation. So the quote is from the Medical Ministry, page 188. It says, "The medical missionary work is as the right hand and arm to the third angel's message, which must be proclaimed to a fallen world. And physicians, managers, and workers in any line, in acting faithfully their part, are doing the work of the message. From them, the sound of the truth will go forth to every nation, kindred, and tongue, and people." And so, what we do in the hospital, when we report to work every day, we should have this mindset that what we do is contributing to the mission and to the saving of souls. And, every interaction that you have in the hospital is an opportunity to represent Christ. You may not be taking care of the patients in terms of medical needs, but you may be in housekeeping, you may be in the business office, but when you represent Jesus, when you show kindness, or in the people, to the people that you meet in the hospital, that becomes an opportunity for them to have an impression of Jesus Christ. I remember a story again that some people who would come to one of our hospitals would say that they sense a different presence and atmosphere in the hospital. They feel that God's presence is there, and it's brought about by people who are smiling to them, who are greeting them like sincerely and taking care of them, and so we never know, what we could do in terms of meeting the spiritual needs of people. Like the nurse who attended to my mom and who befriended her, she didn't even know that my mom got baptized. And, I can tell another story about that. But we have very unique opportunities. And for me, that would make my life more meaningful. So even in my work here in the division and having to serve 20 hospitals with different kinds of problems and challenges, it can be stressful. But I know my why. Simon Sinek said, you have to know your why. I know my why, that the goal is the soul. I may not be directly involved, but I have my part to contribute to it. And so that makes my life more meaningful. So for you in the hospital, you don't know that your smile can make a difference in someone else's life. So let's, be passionate about mission, about our purpose. And that is like ministering to the spiritual needs of people, and hopefully eventually being able to lead them to Jesus Christ. And that gives a different inspiration for the day.
Mm-hmm. Thank you. I thank you for hanging out with us for a few hours. It's been great. And I hope that in the next podcast we have together, we can dig deeper into the mission of our healthcare system and find ways how we are going to be collaborating for promoting Christ's soon return. There you have it. That's another episode of Adventist Asia Podcast. And so if you have not yet heard the previous episodes and insights into how our church works and how our directors and coordinators have been strategizing ways of building the mission here and promoting the love of Jesus Christ, go head over to our Spotify account and our YouTube account that has all the previous podcasts there, and you can watch them at any time that you'd want at your convenience, and you get to learn more about how our church works. Until next time, God bless, and we'll see you guys in the next podcast.